I call Barbara Stewart, 5 minutes.
Thank you, Mr Speaker. In New Zealand First, we've made our position very clear on the 2015 budget. We see red, we see red, and we see red. But it's not just the books that are in the red. Basically, the vision of the government is in red, not forward-looking in any way. Basically, the budget has been a missed opportunity to invest in long-term solutions and prevention. We need to reduce further demands on our healthcare system down the road. We know that New Zealand's on the verge of a great population shift, and that will mean a change in the demands on our healthcare system. We know that the over 65 population is set to double to 1.2 million people over 20 years. And unless this government shows that they have got a plan for combating this or trying to manage this, the whole situation is going to become totally unmanageable. Our over 65s deserve to be cared for with dignity, and they need an appropriate conditions for them to live out their lives with some sort of dignity and pride. Without some sort of action in aged care, this sector will become unsustainable. Without investment, there will be staffing shortages. We know that the aged care workforce is actually struggling to try and recruit and retain quality staff because the work is just too hard, too heavy for the miserable pay that they actually receive. In Budget 2015, absolutely nothing for the aged care workers. Aged care workers will be seeing red. But it's not only them, because for every other New Zealander, when they're looking ahead to their years and the 65 plus, people in their 40s and 50s, they should be seeing red as well, because what is going to be there for them? And all of this because of the government's inaction today. But the coming crisis is not only going to be within the aged care sector, it's also going to be within the demand for surgery. Now, while we appreciate that extra money was made available for surgery, the demand is not going to be met by that extra money. There will be longer waiting lists, and we know that the nurses and the doctors are in panic mode because, of course, there was nothing in the budget to ensure that more nurses and doctors are recruited and retained as well. So we have a higher demand on the waiting list and a shortfall in what can be offered. Health professionals tell us that the sector is absolutely devastated, underfunded, and they are the ones that see the result of underspending. So, of course, they are also seeing red. And, of course, we just have to look to the Southern DHB, a deficit of $17.8 million. The funding for Oamaru Hospital has been cut 5% for next year. Dunstan Hospital in central Otago is set for a $1 million shortfall in funding, with predictions of closed hospital wards and lack of staff and service reduction. So all of those locals are going to face a long trip to Christchurch to get what they need. We once ran a health system that was world-leading. Today it has been weakened beyond compare, and of course everyone is just seeing red. Doesn't need to be this way. The answer is simple. Invest some money now to save some lives and further money further along the road. The extent of missed opportunity within this budget to do that is evidenced by the bowel cancer screening program. We know that bowel cancer is a terrible disease, killing 1,200 New Zealanders per annum. And of course, nothing in the budget for this. We saw an extension of the very successful Waitemata bowel cancer screening program, but nothing for the rest of New Zealand. Is this an example of what we're to see? Health by postcode? We really hope not, and we're seeing red over that. Thank you, Mr Speaker.
I call Melissa Lee.